Do your legs ever feel heavy, achy, or looks like a roadmap? You're not alone. Millions struggle with varicose veins, often dismissing them as just cosmetic issues. But what if I told you there's more to these twisted veins than that meets the eye? Stay tuned, because in this video, we're going to uncover the real story behind varicose veins, the causes, the concerns, and the most important, what you can do about them. Varicose veins are enlarged, twisted veins that often appear swollen and raised on the surface of the skin, usually in the legs and the ankle region. They occur when the valves within the veins that keep the blood flowing towards the heart become faulty. Instead of moving forwards, some of the blood flows backwards and pools in these veins, causing them to stretch and bulge. Here is a breakdown of the common causes. Genetic. A family history of varicose veins is significantly increases your risk. You might inherit a predisposition for weaker vein walls or faulty valves. Age. As we age, the veins and the valves in our leg lose their elasticity. They weaken, increasing the likelihood of varicose veins developing over time. Gender. Women are more likely to develop varicose veins than men. Hormonal changes during pregnancy, menstruation, and menopause can relax the vein valve. Hormone replacement therapy and birth control pills might also play a role. Pregnancy, an increased blood volume and pressure on the veins of the leg and the pelvis during pregnancy due to the baby can cause varicose veins. These often improve after delivery but not always completed. Obesity. Excess weight puts extra pressure on your veins, especially in the legs, making it harder for the blood to return to the heart. Prolonged standing or sitting. When you stand or sit for a long periods, gravity makes it harder for the blood to flow towards the heart. This increases the pressure that can damage the valves over time. Deep vein thrombosis or blood clots in your deep vein can damage the valves and increase the risk of developing varicose veins. Tight clothing and high heels. They can restrict blood flow in the legs and potentially contribute to the development of varicose veins. Now, coming to the symptoms, what are the symptoms of varicose veins? It can vary from person to person. Some of the individuals may experience only a mild cosmetic concern, while others can have a more noticeable and uncomfortable symptom. Here are the breakdown of the common signs and symptoms. Visual changes, visibly enlarged veins. These are the most obvious signs. Varicose veins appear as swollen, twisted, and often bulging veins, usually on the legs. Dark purple or blue color. The veins may have a bluish or a dark purple hue. Sometimes you may have something called as spider veins. They are small cluster of spider-like veins, generally red, blue, or purple, that can appear on the surface of the skin. They are a milder form of varicose veins, or you can tell they are the initial stages of varicose veins. Physical sensations. Aching or heavy feeling in the leg. This discomfort can worsen after prolonged standing or sitting. Burning, throbbing, or muscle cramping. You might experience these sensations in the lower legs, especially during the night. Pain worsens after sitting or standing for a prolonged time. Conversely, pain may improve when you lie down or you elevate your legs. Itching around the areas of the veins. The skin around the veins become itchy and darkened. Swelling sometimes in the lower legs and ankles. This can be mild and may worsen at the end of the day. Feeling of tiredness or heaviness in the legs is another common symptom. Nighttime cramps or restless leg syndrome are also other changes.